Welcome to Optimal Health Weekly with your host, Steve Adams. This podcast is for highly driven professionals, CEOs, and entrepreneurs who know health is the first wealth. Join us each week for a mix of expert interviews and solo episodes on health topics relevant to your busy life. Let's elevate your health together.
Hi, Steve Adams here. I am the CEO and founder of Tiger Medical Institute, and welcome to the Tiger Optimal Health Podcast. And I'm so excited. Today we have Dr. Daniel Kessler. He is one of the lead physicians at Tiger Medical, and he's going to share today about early detection, the early detection revolution, emerging technologies in disease prevention, and exploring new screening tools and technology for early disease detection. Dr. Daniel, welcome.
Thank you so much for having me today.
Oh, you're welcome. You're welcome. And Dr. Daniel, rather than me reading the bio, give us a little background for the audience, because you've got a tremendous background, starting with your parents, and coming to Atlanta and then Northeast Florida, and just talk about some of the things that have formed and shaped your skills as a clinician.
Yeah, thank you so much. So I was born in Germany, and I'm now almost 50 years old, hard to believe. And for many years, my parents had a leading clinic in northern Germany in a small town of about 10,000 people. And my father was an internist, and my mother worked in the office as well, along with about 25 nurses. And they saw patients from all over the world that would come to their clinic with a chief complaint, oftentimes of not feeling well. And when they utilized, first, these people would come and their tests were reviewed with my parents, but oftentimes traditional testing was all normal, and the people still didn't feel well. So it was there that I really learned about additional modalities that they used to identify reasons why people didn't feel well. That was sort of the first seed that was placed in my own medical journey to become a doctor.
Were your parents seeing people that probably had saw many other doctors beforehand, and they were coming to them because they were looking for a different answer?
Indeed. So one of the things that was very important for my father was to combine traditional medicine and integrate natural solutions as well. It was very important because some patients would come in with certain metabolic imbalances. Maybe somebody had, thyroid problems, cholesterol problems, heart issues. So oftentimes medicines were already there. But when you really want to dig deeper, then technologies had to be utilized to identify what those disturbances were. And that was the goal of the medical team in my parents' practice.
Got it. Okay. So keep going. What was next for you?
Yeah, and then I was fortunate after my high school. I then came to the US in 95. I went to Emory University in Atlanta, Georgia. I was very privileged, fortunate to go there. And then after I got my chemistry degree, I decided that I wanted to work at the Centers for Disease Control and Prevention for 2 years, which I did. And I was working at the National Center for Environmental Health. What I learned there is that even today, what I do with my patients, that the environment is a huge contributor when it comes to both illness, but also wellness from a preventative standpoint.
And then where did you go to medical school after that?
And then after I was done at the CDC, I went to Nova Southeastern University, which is down close to Fort Lauderdale.
Yep.
And then I, again, was very lucky to complete my residency training in family medicine at Mayo Clinic in Jacksonville, Florida.
That's great. Yeah. So it's a very diverse background. And then I know you also took that environmental medicine further with the clinic in Switzerland. You want to unpack that a little bit?
Yeah, so for the people that are listening, when you don't feel well, then you have to work with someone who understands both the traditional aspect, to make sure that no stone is unturned, to make sure that we don't miss something bad like cancer or something.
Right. And
Um,
that's what you are. You're a medical doctor. Yep.
yep, yep. So that's step number one. And then after I finished my training at Mayo, I did continue training both in the US and Europe in something called European Biological and Functional Medicine. And specifically in Switzerland, there are two leading clinics where I did training where you can actually identify what those hidden environmental toxins are
Mhm.
with specific testing. Sometimes the testing can be done in your home, and sometimes it can only be done at the clinic.
Mm.
But the reason why I wanted to do that is similar to my dad's journey. At some point, traditional medicine didn't have all the answers that a patient needed, both from a preventive standpoint to say, what could I do to prevent what happened to my family members, for example, or here I am, I'm on all these prescription medicines. What else can I do naturally? So I really wanted to have additional tools in my toolbox to offer for the patients.
Mhm. That's great. Well, and then obviously you've been a doctor working with patients for roughly
Almost
20
22
years.
years. Yeah.
Yeah, yeah. And and you've been working with Tiger for some time now and have quite a number of patients that you're working with.
Yeah.
Um, what would you say the top three, four things you see of middle-aged people who have been successful, worked hard, but didn't take care of themselves? What are you seeing in general when they come to you?
Yeah, I think the number one thing is really metabolic imbalances. So the
Yeah.
metabolism for your listeners is a combination of all the chemical reactions in your body. And oftentimes you will see hormone imbalances. Um, that can be anywhere from blood sugar dysregulation. So some people may be overweight, some people may be pre-diabetic, some people are diabetic, type 2 diabetic.
Yep.
Um, and then a lot of people have thyroid imbalances. But the number one symptom that really stands out oftentimes is also fatigue.
Mm-hmm.
And then when you do testing, then you can see how much of this metabolic imbalance and hormone imbalance is contributing to fatigue, for example.
Right. Yeah, exactly. And I know from talking with our other physician at Tiger Medical, he sees a vast number of people have, elevated or out of balance lipid markers, and they have also a lot of people come with the toxin burden and then microbiome imbalance, leaky gut.
Exactly, exactly. So, and
And
then
all of that together can contribute to someone not feeling well, correct?
it does, it does. And I always, when somebody feels tired, for example, then the first thing I do is when I work with them, I ask them, do a little energy audit and ask yourself, where are you spending your energy? Are you spending it meaningfully, purposefully, or are you not spending it meaningfully or purposefully? Like,
Mhm.
where's your energy being drained? And oftentimes that is an eye opener for a lot of people because they are just so focused on numbers from blood work that they don't realize it's the environment that they're
Yeah.
currently living in that
Yep.
is making their blood work abnormal. Yeah.
Yep. Right.
So when you think about cholesterol, for example, then only 15% is diet related, 1 5.
Wow.
But cholesterol, which is produced in our liver, also responds to stress
Yeah.
because all our hormones come from cholesterol.
Hmm.
Many patients I work with, I say, hey, have you been under stressful environment for whatever reason? The answer is yes.
Always.
Once that stress gets removed, we identify, oftentimes the lipids also normalize.
Yeah. or at a minimum, if we can't remove their stress environment, you can teach them to mitigate it through
Yes,
diaphragmatic breathing and meditation and things like that.
correct.
Yeah, yeah, yeah. Oh, it's very interesting. So, one of our title, we talked about, kind of what are some of the exciting tools that you see as a clinician now. And the reason I had you on this is because, I have other doctor friends, they don't seem to really kind of lean into continuous learning. You're not that way. You're always learning new things. What are the top few things that you're excited about in terms of tools that you can use now, maybe you didn't have 5 years ago? And hopefully one of them is the glycocalyx type testing. Yeah.
Yeah, I think since this podcast is also about prevention,
Yes, definitely.
so the reason why I'm doing this work is that my father, who I mentioned earlier, was a medical genius, but he ended up dying last year. Unfortunately, he did get COVID, but he also developed some blood clot problems and some heart issues. And we did not know at the time that there was a little bit of a predisposition
Yeah.
because simply put, the tools didn't exist.
Yeah.
And you mentioned glycocalyx. For those listeners who don't know, the glycocalyx is really, um, if we think about arteries in our blood, then there is a lining of the arteries that is a very thin lining. Underneath this lining, you have connective tissue. So if we think about damage or inflammation, a lot of our listeners have heard the word inflammation before.
Mhm, mhm.
Then basically what is damaging us early that we don't know what the reasons are. And technology has now advanced to a point where we can non-invasively check and test people if certain early inflammation markers are present and what the data shows. And the glycocalyx will probably have another podcast or a webinar on that more in detail at some point,
Right.
where we
Yep.
can show, because showing a potential person is much more important than just talking about it.
Right.
But if your listeners can imagine by looking at the connective tissue and connecting the dots, what is damaging, then with the glycocalyx, you can predict sometimes up to 7 years ahead of time if somebody is at risk for heart disease. In fact, the doctor, his name is Dr. Vink, Vink. He is one of the founders. He has been so well published in so many scientific journals where he shows data looking at people over a 7 year time frame, for
Mhm,
example. And that's
mhm.
just fantastic. So what this means is that if somebody has high cholesterol, high blood pressure, pre-diabetes, or overweight, or tired, and maybe, they've had some testing done with their cardiologist and everything is normal,
Yep.
it actually means that it may not be as normal as they think. And then with what we do at Tiger, for example, we now have tools where we can then early identify this much better
Right.
and then provide solutions that they just didn't know existed.
Right. Yeah, no, that's excellent. Let's talk about, so you've got a 58-year-old male, he's a little bit overweight and his lipids are really high. Maybe he's got a genetic predisposition to poor cardio genes, poor
Mhm.
cardio health. Um, you know, there's tools well beyond, the traditional nuclear stress test and things like we used to do. Can you talk about things like the Clearly scan and the calcium score and why you would do calcium score and not Clearly, or when do you do both? That kind of thing. Just kind of help the
Yeah.
audience know what that is.
Yeah, I think that, we're mentioning a lot of different items during this quick, short podcast today,
Yes.
but if your listener imagines, for example, and pictures a garden hose where water goes through, then
Mhm.
the garden hose represents our arteries. So in our body, we have large hoses, large arteries, and small arteries. And when we think about plaque buildup or a plaque burden, that can lead to blockages of the flow, just like a garden hose can be blocked by debris, then the debris that a lot of people think of is the cause is cholesterol.
Mm,
And that is not true.
right.
And because cholesterol happens or buildup happens after the initial event of inflammation has occurred. So if we do testing with blood testing, for example, we can then identify via blood testing and the glycocheck, the glycocalyx, is there early changes present? Are there early changes present? Now, clearly, for those listeners who don't know what that is, clearly is an AI software that interprets the results from a CAT scan or a calcium scoring CAT scan is like a type of X-ray where we look at the arteries, especially around the heart, the coronary arteries. And then what's so cool about it is we can see without being invasive if plaque is present. So a lot of patients want to know, for example, I feel fine. I have no chest pain, no shortness of breath. Could I still have heart disease? And the answer is yes, a resounding
Right.
yes. So 50%, this is a pearl for listeners, 50% or more of people have heart attacks with normal cholesterol.
Wow.
So that's why if you go to your doctor and do cholesterol testing and say, hey, I'm fine, you may not be fine.
Can I interject a little quick story there, as it
Hmm.
relates to me personally, and I'm happy to share this. My
Yeah.
father has had 9 heart attacks. People just shake their head when they hear about this. He's had 8 stent operations. Some of them were multi, and he's had an open heart surgery. He's 83 years old. His first one was at 56. His dad died at 62. His two brothers died at 53 and 46 of massive heart attacks. So, as you might expect, when I turned 53, I started having some chest pain, and it was reflux oriented. But I went in and did a nuclear stress test. The guy said, "Why are you in here? I don't see anything." And so when I learned about Clearly, I went ahead proactively and paid for it out of pocket, even though I had a calcium score of 0, because I wanted to know definitively where I stood. Even though my lipids were okay, I still wanted to know. And I went in and they found almost no blockage, like 0. And it was great for me because it was peace of mind. And it validated what we do at Tiger in the sense of, just because, and I want you to comment on this, just because my genetics suggests I have suboptimal cardio pathway genetics, you can change the narrative on your health. Because 10 years ago, I started making changes.
Yeah. I think if there's a take home from all of this, then um, it's really about simplification. If you think about the environment that we live in nowadays, the environment is always going to be stressful,
Yep.
unfortunately. But what can we do to nurture ourselves? So nature versus nurture, that never-ending debate.
Yep.
Some people, they say it's genetics, but it's really the epigenetic part. Means what this means is that the environmental choices we make, that we live in, have a direct influence on our circulatory system, for example. So you mentioned peace of mind. Yes, I think peace of mind is, if we think about myself, so I have a calcium score of 0 as well. But some of my blood markers, my advanced markers were positive to the point of saying, I probably need to do some supplements, some natural solutions for myself
Yeah.
because, you know, my dad died last year from heart issues. He didn't know. So I take that very serious. And then I think if you meet people and you can meet them on the same level as a doctor and saying, hey,
Sure.
you have a dad who had, 9 operations. I have a dad who had, then the why of why Tiger exists and why we get involved with companies like GlycoCheck and GlycoCalyx, it becomes more meaningful.
Yeah.
So this way, people now know that solutions exist both from a preventative standpoint
Yep.
and from a treatment standpoint, even if people have existing heart disease.
Yeah, and it's, you referred to that study that Dr. Vink did. It was like 92% accuracy in predicting in a healthy population of patients of 600 people. They predicted 55 of the 59 who ended up over the next 7 years having a stroke or a heart attack or a serious vascular event. And so, yeah, it's incredible when you can get this kind of screening technology between the clearly scanned, the glycocheck. And we should probably also talk about, like, the company that has the glycocheck has a supplement called Revasca that has just been released, Revasca, and they've got several clinical trials going on right now. But one of the things that it does is within 45 to 60 days, it will normalize a treatment-resistant hypertensive patient into normal blood pressure. It's incredible. It also provides protection around these cardiovascular issues.
Yeah, I think what's really important whenever people hear the word supplement, then the first thing they think of, oh, here we go.
Yeah, right.
But what's different, what I really appreciate when we look at the research
Right.
behind GlycoCheck, the device, and you mentioned the studies. Not only do the studies exist, but the device has been utilized by so many research institutions and hospitals, not just in the US, but even
All over the
in
world.
Europe, in Asia.
Mhm.
Why? Well, because heart disease is ubiquitous.
Yeah, it's
Um,
a human thing, right?
it's the number one killer, right?
Right. Yep.
So I think that's why having this tool to tell a patient you are at risk, yes or no, and if they are, well, what can I do about it besides my lifestyle and diet? Well, there is a patented option for you available as well that is research backed with multiple studies
Right.
because most of the supplements out there are not FDA regulated
Right.
and you never know what's in it. So that's why I'm really excited to see not just currently that the glycocheck is available, but what's down, what's in the pipeline. So I'm very excited for years to come.
Yeah. And Daniel, what if you're a person out there listening to this, like, I've heard doctors say we should know things like our ApoE4 status, which you can explain in a minute, and other things. If there were three markers that you would definitely want to know, or five, you tell me, three or five, what would they be? That everybody should know if they really care about being proactive and preventative.
Yeah. So like I said, this podcast right now may be like drinking from the fire hose. A lot of listeners hear about all these different things, but the thing is, when you look at cholesterol, for example, then there is something called ApoB, so APO and then capital B,
Yep.
which represents the total amount of particles of cholesterol in the body. In the old days, a lot of people still focus on the LDL, the so-called bad cholesterol, but so much research is now shown that the ApoB is one of them, and the ApoB number should be less than 80.
Yep.
The second marker that's really important is the hemoglobin A1C, which
Yep.
is a 3 months average of your blood sugar. And that number should be ideally less than 5.7.
Yep.
Now, some people can still have blood sugar irregularities, which can be monitored with things like a continuous blood sugar monitor we can
Huh.
use. Um, and then the third thing is really also the blood pressure,
Mhm.
um, because a lot of people don't know that their blood pressure is elevated because they may not feel it.
Yep.
I think going, get it measured, measuring it yourself, knowing how to measure it correctly, the right size cuff, and then the normal blood pressure should be 120 over 80.
Yep.
And there are so many people that are in the 140, 150, 160 range, where most doctors will say, oh, it's not a big deal. But when you think about pressure, then in physics, it's force divided by area. So what are the forces in your listener's environment that are acting on the body that causes pressure? And then if the area is very small, like the small arteries in our body, if you have a very high force acting on small area, you get problems.
Right.
And that's why in medicine we talk about end organ damage like strokes, heart disease, kidney problems, eye problems. And it is these capillaries, the small arteries,
Yep.
that the glycocheck along with the glyco measures. Exactly.
Yeah.
So
Right.
now if you have a listener who says, oh, I went to my doctor and my blood pressure is only 140 over 80 or 150, he said everything is fine, just see me in 3 months. Those 3 months could be utilized preventatively
Right.
by getting your glycocalyx score, for example,
Yep.
plus lifestyle, and the outcome would then be much better. So those would be 3 months well spent.
Yeah, and also the Revasca supplement helps
Yeah,
restore microcapillary
yeah,
profusion, if you will, or
yeah.
dissemination, and so better blood flow leads to less blood pressure. Yeah.
Exactly,
Yeah.
exactly. So if we now go back to the garden hose analogy and say, okay, what kind of debris do I have in my hose, in my garden hose? What can I remove? How can I clean my arteries?
Yeah.
We're not by any means saying that the supplement can reverse plaque, or that's not what it does.
Right.
But from an inflammatory standpoint, to decrease some of the risk factors along with lifestyle changes, that's
Correct.
really what we're talking about.
Exactly. Yeah, it's not just a pill, right?
Yeah.
I think one other one that I wonder about is for people who are concerned about long-term brain health and cognitive disease. Is there a marker or two you like to know about that kind of sets them on a journey?
Yeah, so first of all, there's not a single marker that is going to
Right.
tell you
Yeah.
that you're fine. Um, I think that one of the other certifications that I have is through a neurologist from
Mhm.
California by the name of Dale Bredesen.
Yep.
Dale
UCLA.
Bredesen, yes, and Dale Bredesen is the expert on Alzheimer and early cognitive decline reversal. So he has a book that he wrote
Mhm.
called The End of Alzheimer's. And so if a listener is interested in brain health, that would be a good book to get.
Yeah,
And
definitely.
then the book talks about 36 different reasons that could contribute to somebody having brain problems.
Yep.
Um, Sugar is one of them, cholesterol concerns, blood pressure, those are just some of them.
Toxins. Yeah.
And you mentioned earlier the ApoE. Um, so if somebody has genetic predispositions, then what that means, there is a higher chance
Hmm.
that something could happen. Not,
Emphasis on could.
yes, not that something will happen,
Right.
right? Um, so with my dad and my mom, they both also had a little bit of some neurodegenerational issues going on. That is sometimes inevitable as we get older.
Yep.
But the good thing is, if you look at the circulatory system, then the arteries that feed your brain are the carotid arteries. So how easy is it for a patient to say, let's do the one marker, the one test, look at your health of your arteries to make sure that the brain also gets the right amount of blood flow
Yeah.
and the right nutrition. So that's why whenever we look with Tiger at cardiometabolic health, many patients also are concerned about their brain health. So we always look at both.
Yeah, and just because you have one or two copies of that ApoE4 gene doesn't mean you're going to get it. You can be proactive in your lifestyle changes to help
Yeah,
prevent it.
yeah.
And so, a question for you, there are these mobile groups that will go and scan carotids. If you're getting a glycocheck test once or twice a year, do you need to do a carotid scan?
So those two tests, they test different things.
Got it. Okay.
Because there's actually three types of tests. There's the carotid ultrasound.
Yep.
Basically, you take a little bit of gel that gets placed on your neck. You have a probe that you push against the neck that the operator pushes, and then it looks at the blood flow
Yep.
of the carotids,
Yep.
and then it measures if there is plaque present. And if there is plaque present, how much is bad? So oftentimes they say more than 70% blockage would be concerning.
Yep.
Now, the glycocheck is a test that goes under your tongue
Yep.
and it measures more the small, the health of the small arteries, the capillaries. So it would not measure the large arteries in the carotids.
Gotcha.
Now, the third test that some listeners may know of is called the carotid intima media scan, where it's like a similar to an ultrasound where we look at the layers of the arteries more in detail. And oftentimes we see thickness of how thick the layer is because of underlying inflammatory reasons. That combined with glycocheck would be, in my opinion, the two best things you can do early,
Mhm.
preventatively,
Yep.
along with
Yep.
advanced blood work markers, ApoB status. And then if somebody then wanted to look at the large arteries more in detail, then you can always consider doing a calcium score plus clearly.
Yeah, and when you think about all of this, you're empowering someone with clear data that it can help feed their motivation to make the lifestyle change because it's not easy. You got to learn how to manage stress. You got to learn how to sleep better. You're going to fast. You're going to move. You're going to eat.
Yeah, 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 yeah. That's why it's so nice with Tiger. Tiger also has the 8 habits that Tiger teaches, where we also look into things like, the sleep status. We look at the diet. We look at stress management. What does that really mean? And
Right.
we also look at things like heart rate variability. So, um, bottom line, um, bottom line is the take home is if you have an artery, a garden hose, what is damaging the lining of the garden hose? That's the small arteries, and then the layers of the hose. Um, and then how does cholesterol fit into that? So it really has to be this comprehensive approach when you think about cardiometabolic health.
One last thing. Someone has cancer risk in their family. What would your suggestion be? What's the best way for somebody to evaluate that risk?
Well, I think preventatively, so in my family, we have colon cancer.
Mhm.
So my grandmother had
Family.
metastatic colon cancer.
Mhm.
So if somebody, for example, suffers from colon cancer concerns, then early detection is key. So get your colonoscopy regularly.
Yep.
I already had two of them. I'm only 49. My dad got his probably every 3 to 5 years. Um, but um, when cancer happens, if somebody wants to know what they can do to prevent it, it really goes back to lifestyle change and nutrition.
Mhm.
Because if you think about the arteries feeding the organs in our body with blood, then what's the quality of the blood going to those organs? Is the blood healthy? So doing deep analysis of um, you know, minerals, vitamins, toxins that you can test for, um, for example. Those are all things you can do. And then finally, there are some companies out there who may offer um, um, cancer testing.
Mhm.
Um, those are relatively new companies. Um, you always have to take those tests with a grain of salt because when we look at circulating DNA, for example, in the body or certain cancer markers that may be positive, then there's going to be a level of anxiety that comes with that.
Yep.
And then oftentimes there's going to be additional testing involved, which could also cause some harm if you think about like, radiation exposure from scans and whatnot. But
Right.
I guess if we think about um, being a student, a lifelong student of medicine, and medicine is always evolving, then new technology is the norm. We are getting better and better to identify things earlier. But what the listener can do today is maybe you could put a link under this podcast for the habits. Learn
Yeah.
about what are some of the habits you can do every day to
Right.
to decrease some of those risk factors.
Yeah. Oh, that's good. And you know, when I got to age 53, I was so exhausted and not feeling well that I chose to quit something, sell it, and then went on my own journey and met Dr. McNamee before I knew you, and he kind of helped use the same approach and rebuilt me from the ground up. And so that's why Tiger Medical got started. Was there's just a lot of people that are suffering, and what we've created with you and Dr. McNamee is an organized process of um, root cause medicine, getting to the root underlying mechanisms that are causing people to feel badly and addressing them as a solution rather than as a treatment and a management of condition. So that's what's exciting about this. And, what you guys are doing is just tremendous. And it seems like, and maybe you can weigh on this as we close, is, if someone enters into this process with you, and if they follow through on what you're asking them to do, it's almost every single time you can objectively show them they're better in a year, can't you? If they do.
So yeah, yeah. So I always tell people that what we're very good at is to identify the reasons why someone doesn't feel well.
Yep.
And then it's a process where we support them on their journey. But ultimately, as a patient, you have to
Yep.
you have to do the work.
Yep.
And sometimes that may not always be very sexy, you know,
Yeah. Right.
to do boring things, every day. But that's exactly what you got to think about. If you got here in a certain way, why did that happen like that? And how are you going to pull yourself out of it?
Right.
Well, you cannot pull yourself out by, with your own hands. You need somebody to help you.
Yeah.
Um, but I will tell you that if you identify the toxins, you find the mineral, the vitamin issues, the imbalances, and you fix it, then the body has this innate healing capacity. The body knows what it needs to do. And then objectively and subjectively, people usually within a few months start noticing the differences. And then comes the real fun is to maintain it.
Yeah.
Hence the boring part. Now you got to do every day consistently what got you out of that situation.
Right.
Yeah. Yeah.
Exactly. They're sick because they behaved their way into it, and you got to behave
Yeah.
your way out of
Yeah.
it.
But the nice thing is that some people that work with us are sicker than others.
Mhm.
Um, but everybody has the desire to live full and to live long, to live happy.
Yep.
And I think once, you work with a doctor who understands that process, having someone like that on your team is just priceless.
I agree. Well, Dr. Daniel, thank you for taking time and just all the amazing work you do, the impact you've had in my life, and we're grateful for that.
Thank you so much for having me today.
Steve Adams here from Tiger Medical Institute, talking about the True Health Assessment. What if you could safeguard not just your health, but the well-being of your entire family? With the True Health Assessment from Tiger Medical, you can. Our comprehensive blood screening identifies hidden risks before they become major issues. Our elite team of Mayo Clinic trained and naturopathic physicians then create a customized plan to optimize your health for years to come. When you prioritize your wellness, you ensure you can be fully present for the people you love most. Don't let preventable issues cut that time short. For less than the cost of a daily latte, you can gain peace of mind and a clear path to sustained vitality. Protect your future and your family's future with True Health Assessment from Tiger Medical at thetruehealthassessment.com. Again, that's at thetruehealthassessment.com.